In this video, we are going to talk about stroke rehabilitations for arm and hand, and I'm going to mention a few presentations that's commonly seen among stroke survivors. Please stay until the end of the video. The first presentations that's commonly seen is shoulder subluxation. In this picture, you can see that there's a 2 fingers gap under the acromion roof and also humeral head. This is because of there's a shoulder muscles flaccid and weakness and during the acute phase, and also the muscles is too weak to hold up our shoulder joint. So if there's an improper of positioning and also handling of the arms or accidentally pull the arm, it will cause the subluxation getting worse. So please consult a physiotherapist on how to properly position your arm when you're sitting, when you're lying, and also how to support your arm properly when you're walking. So this is very important to prevent further conditions like the next problem, which is the shoulder pain. So the shoulder pain and shoulder stiffness, it will happen when there's an improper movement of the arms. So some of the stroke survivor will tend to move the arm very too fast or in a improper positions, and it will cause a lot of impingement of our shoulders. And there's also causing inflammation of our the rotator cuff tendon as well. So if you find that you have shoulder pain, or when you move the arm up to maybe a 90 degree or 60 degree, the pain started already, and you feel there's a stiffness, you must treat it accordingly and also immediately, so that to prevent further worsening. And a proper movement training is very important because we want to relearn the movement of our arm after the stroke and prevent we are using the wrong muscles. So please consult a physiotherapist to help you with the shoulder movement regain. The next problem that usually the stroke survivor will complain is you feel that there's a tightness of your arm and your arm is keep bending when you're walking or when you feel cold. Yeah, this is quite commonly seen among stroke survivor. So this is because of when you walk and when you feel that your balance is challenged, or when you feel the coldness, there's a spasticity happens. So means that the muscles is like pulling in an involuntary way. So this is need to manage properly to train back our muscles to actually able to control. Another thing is we need to manage the spasticity properly, and this needs professional advice on it. And the other thing is if the muscles is too tight and the movement is very limited, so especially around the shoulder joint, we need to do some manual therapy on our shoulder joint to mobilize the joint and to prevent frozen shoulder as well. So because frozen shoulder is very common amongst the stroke survivor as well. So what are we going to do for all these 3 common conditions? So firstly, we are doing more on the hands-on therapy, and also after the hands-on therapy, we train back the movement. Training back the movement is very important during the acute phase up to a chronic phase, because we need to relearn the movement. So for the shoulder and also for our hand and also for our forearm, because we need to relearn the movement so that our brain and our arm is reconnected. Another thing is also we need to train back our muscles how to control the movement. When we train back the muscles, we can use some of the tools, for example electrical stimulations, to activate the muscles so that to actually try to wake up the muscle. It's a wake up call for the muscles. And during the electrical stimulation, we also try to relearn the movement. Another things that we also try to use is using the robot training to actually train back our grabs and release of our palm. So these are all the tools that we are going to use. Subsequently, we also need to train back our function. For example, how are we to grab something and put near to our mouth? Another thing is always you're having the problem is how to keep our hand beside by our body so when we walking. So this is to relearn a proper movement pattern after the stroke. So this is the outcome before and after, how the movement training and also all sorts of training, functional trainings that happens, and this is the outcome of our clients. So if you have any questions or you want more information, please contact us and stay tuned for our next video.